Welcome to Redefining Medicine, an intimate and personalized program that illustrates a different side of the practice of medicine. Our in-depth conversations will focus on mentors and motivators who are consistently reshaping, redefining, and rediscovering the field of medical healthcare. I would like to welcome Dr. Jennifer Landa, a board-certified OBGYN and respected authority and frequent media contributor on women's health, hormones, and functional and regenerative medicine. Dr. Landa is Chief Medical Officer of BodyLogicMD, the nation's largest network of physicians specializing in bioidentical hormone therapy.
What motivated you to first begin to study medicine?
My father. My father was totally committed to me becoming a doctor from practically when I was born, 2 years old or something. He just always told me, you're going to grow up and be a doctor, you're going to be a doctor, you're going to be a doctor. And I actually didn't think I was going to be a doctor for a while. I studied psychology, and I thought I wanted to be a PsyD, get a doctorate in counseling. And I thought I wanted to be a marital and family counselor type of thing. And then when I was in college, my dad's words were, ringing in my head. And people always ask me, so is anybody in your family, is your dad a doctor? And no, nobody in my family. I was the first one in my family to even go to college, actually, let alone medical school. So I don't know. So I was in college, and I sat there and started thinking about what my dad was saying, well, should I be a doctor? I don't know. So I went and did this program during the summer that was for pre-med students, and really we just worked as nurses' aides. So, but you worked very closely with patients every day. I learned how to bring them to the toilet and clean them up and things like that. But through that interaction, being with patients every day, these were stroke patients recovering from stroke at a rehabilitation facility. And what I saw was really that I loved was the progress that they were making due to the care that they were getting. And I'll never forget this one day, I come in the room and this lady, one of the patients I'd been taking care of, she goes, "Jennifer, stop right there." I go, "What?" And she gets up from the chair by herself, and she hadn't been able to do that. And she, we both had tears in our eyes, and I was like, "Oh my God, this is amazing," So look at me, I'm crying just talking about it. And really, I think that was almost the moment, I would say, where I said, yeah, I am going to do this. I do want to study medicine. And I'd been very hesitant about it because the thing that worried me was, could I be a wife, and could I be a mom, and could I, do all that and still be a doctor? And then what I realized was, I'm only 19 years old and I don't have a husband, and so I'm not going to not study medicine for this fictional husband and these fictional children who are now a real husband and real children. And it turns out you can do it all. It's, not the easiest thing, but, you fit it all in.
So what inspired you to become an OBGYN?
So the OBGYN part didn't come till even later when I was in medical school. And in the, traditional medical school, it's a little different now, which is pretty cool. But traditionally, you really didn't touch patients till the third and fourth year. First and second year were all classroom. And then the third and fourth year is when you actually get to feel a little more like a doctor and see patients and things like that. And you would rotate between the different specialties. OBGYN rotation, 6 weeks, that was it for me. First baby I saw delivered, yet again the tears, I was crying watching the baby be born, and I was like, oh my God, I can't not do this. This is amazing, So I really fell in love with OBGYN during my rotations in medical school.
So you practiced traditional OBGYN for how long?
Believe it or not, I only practiced after medical school, traditional OBGYN, for 4 years.
Wow.
Yeah.
How many babies did you deliver during that time?
Oh, hundreds. I mean, we were a busy practice, and of course, even in my residency, I did my residency in Manhattan, in the busiest OB hospital in Manhattan. And then I went to a busy practice for 4 years. So, I delivered, thousands of babies, probably, even during that short period of time, or at least over 1,000.
So what was the catalyst for you to transition your practice into an integrative or preventative practice?
So one of the big reasons I got into integrative medicine was, like a lot of doctors who get into it, was because there was something going on with me that I couldn't figure out. So a little embarrassing, but when I was 28 and I was only married for about 3 years, no kids yet, I was in OBGYN residency, I completely and utterly lost my sex drive. And before that, it had been really strong, though. Like, it had been a really important part of mine and my husband's relationship. And then I got to this point where I literally didn't care if I ever did again. And I was kind of, shocked, confused, embarrassed. But here I am. The worst part, I think, was I was literally just about to be an OBGYN. I was like in my last year of residency. And I thought back, and nobody had taught me anything that I could use to help myself. It had really not even been mentioned. So I didn't even know who to ask, what to do. And here I am supposed to be the expert. So I was afraid to even reach out to ask anybody, what to do. So I don't know. I kind of just, struggled along thinking, okay, there's something wrong with me, but I don't, really know what it is or if it's solvable in any way. And then, and I kind of just struggled over the years with that. My husband and I, we both struggled, but we stayed together and we eventually had kids. And after
Did he realize it was a medical issue?
Well,
or was he thinking
I don't think either of us
right.
necessarily realized it was a medical issue. We just knew there was something not right. He said, I'm not happy about it, but, okay, I love you. I'll stay with you. And so I don't know. I don't know if either of us really spent that much time thinking about it, because just even getting to the point, getting to the point even where we talked about it was, kind of a lot, It was the elephant in the room for a long time. I would pretend to be sleeping before he came to bed and stuff like that, So I was kind of avoiding it. I have a headache. I have an early day tomorrow, all of those things. But then after my first child, things got worse for me that in ways that I didn't realize. It was all subtle, but, looking back on it all, I can see now what happened was I became exhausted. I was just so tired all the time, Now, granted, I was living a pretty busy life. I was an OBGYN and everything, but, when I wasn't on call, I would be sleeping. I just wanted to sleep all weekend, all day, and it was terrible. I didn't want to go out with friends. I didn't want to, and I really didn't even really want to play with my baby. And I felt so guilty, as a mom and as a wife, I was really striking out in a couple of different ways. And then eventually it came to affect my professional life. So as an OBGYN, you have a lot of adrenaline-filled moments, and I used to love that adrenaline. I used to love being on call, getting the beeper go off, getting the call from the nurse. You got to come in now and do an emergency C-section, and jump in the car, drive down. I lived on really curvy, scary roads, and I loved it. I loved the whole thing. And, getting in, doing the C-section in 2 minutes, saving the day, saving the mom and the baby and all that. But I got to the point where, and this was around early 30s, when I'm married, and at that point I had my second child. Yes, and I got to the point where I was nervous about delivering, and I was nervous about operating. And I was kind of getting to this point where I just couldn't take the stress anymore. That adrenaline that I used to find so cool and fun was now like my enemy. And I couldn't understand, and there wasn't anything that anybody had taught me in medical school to explain to me what was going on with me. All I knew was I was just, not feeling myself. So here I am, I have no libido, I'm exhausted, and now I can't handle stress. And, so I felt like a bad wife, a bad mom, and now I feel like I'm a bad doctor. Am I really safe to be doing what I'm doing? And that was one of the big reasons I decided that really OBGYN might not really be the right thing for me anymore. And so at around the same time, I got introduced to bioidentical hormones. I got introduced to supplements. A compounding pharmacist came to our office to tell us about bioidenticals. And then I started to just, investigate a little bit more into the area of anti-aging and integrative medicine. And that's when I found the A4M. And I went to my first A4M conference, and it was like, oh my gosh, there's this whole other way of doing things. And then I wound up in the fellowship, and I wound up doing my fellowship modules, and that's when I figured out really a lot of the things that had happened to me really started with a combination, I would say, of high stress, of course, from residency and all of what I'd been through, but the birth control pill was a really big part, because birth control pills suck down your free testosterone. And so that was probably why I lost my libido when I was 28, because women have the biggest dive in their hormones from the age, in the testosterone specifically, from the age of 18 to 34. So probably I'd been on the pill for all of those years, but eventually my total testosterone probably fell to a point where my free testosterone became so low on the birth control pill that it became a real problem. And then eventually over time, birth control pills do other things too. They deplete your body of B vitamins, which of course are a big part of your HPA axis, your fight or flight system. So over time, that's really what happened to me, why I lost my libido, got exhausted, lost my ability to handle stress. But I didn't know any of that from traditional medicine. But now being an integrative medicine doctor, and, now, having gotten to the point where I've done so much research on all of that, and it's all there in the scientific research, all of the stuff I'm talking about. It's just not in medical practice, and, it's not in medical school. And so nobody taught me what was wrong with me, and so I had to go find those answers for myself. And then, of course, I'm not the only one. I saw lots of patients who had problems similar to mine, and I had to help them fix their problems. So that's kind of a long answer for the way that I got into this stuff, but that's probably a similar story to a lot of us.
Were you still practicing in New York at the time?
I was, yeah. I was still practicing in New York at that time. I had practiced OB/GYN in a traditional setting for 4 years. And then, in all honesty, I was not having the arrangement with the person that I was trying to go into practice with wasn't working out that well. So I decided to go out on my own. And I didn't want to do OB as a solo practitioner. That seemed very daunting. So it was actually perfect timing for me. What I did was I was able to do GYN only. And while I was building up that practice, I was also able to do all my modules with A4M. So I completed the fellowship, and then my husband and I we had talked about it for a while. We really wanted to move to Florida. And that was when, at an A4M show, I met Patrick Savage, the CEO of BodyLogicMD, and I said, oh my gosh, this is the way that I can move to another city and make a practice happen. Because that was my biggest fear. How was I going to reestablish myself in a place where nobody knew my name? It was relatively easy to transition from being an OB/GYN to being just a GYN in a different practice because I was in a town where people knew me already. But I had no idea how I was going to do that, moving from New York to Florida. And so when I found BodyLogicMD and I asked them, Orlando, is that a good location? They said, that's a great location. I said, okay.
Did you have children yet at the time?
Yeah. That was the main reason we moved, really.
To get them closer to Disney World, I guess.
Yes, absolutely. To get them closer to Disney World, because we are that good as parents. No, living in New York, we lived about an hour and a half commute from Manhattan for my husband, and he was commuting to Manhattan, and it was a long commute. And because it was so long, we decided to get an apartment, and he was staying at the apartment several nights a week. So basically, my kids were 4 and 6, and he was never home. And I said, this is just not working for us. And, okay, so this is strange. So the reason we lived so far outside of the city was because we lived on this beautiful lake because my husband was addicted to wakeboarding. And if you don't know what wakeboarding is, it's kind of like snowboarding behind a boat. And so he was so attached to this lake. I said, you know what? If you want to be that attached to wakeboarding and a lake, then we're going to need to move somewhere where the lake is closer to the office. And so that's what we did. Orlando, we're 18 minutes from the office on a lake.
That's great.
And so our kids have grown up in Florida on a lake. And so, yeah, they were 4 and 6 when we moved.
I'm sure that it also made it you far more sympathetic when a patient would come to you and say, I'm 33, why do I have no sex drive? The light bulb goes off, your heart starts warming up, and you can actually identify with an issue that they're having as opposed to writing that pill for their ill.
Right.
So that's It's an unfortunate story, but with a happy ending.
Yeah, you know what? I don't regret any of it because I think, it all just, each piece brings you to where you're supposed to be and where you're supposed to go. And, now I people ask me sometimes, do I miss OBGYN? Somebody asked me this just the other day, and I said, actually, not at all. In my practice now, people say to me all the time, you've saved my life. You've changed my life. You've saved my marriage. Just the other day, I had this patient for her 6-week follow-up after she had come in as a new patient. She's 59 years old. She survived leukemia. And she said to me, I couldn't believe she said this, but she said, I've had 2 doctors who've saved my life. 1, the doctor who saved me from my leukemia, and 2, you. You've saved my life. You've just changed everything for me. And to hear that every day is actually even more exciting. Yeah, it's even more exciting for me in some ways than delivering babies. Because you know what? I feel like there are tons of doctors out there who do great deliveries, great GYN surgery, great pap smears and whatever. But there aren't a lot of doctors who've kind of delved into this area of study and become bioidentical hormone experts and can really, help people the way that I'm helping them now. So I actually find it even more gratifying in a lot of ways.
Did you put your mother on them?
Oh, I don't know if you want to go there.
Okay.
Well, we can go there. Yes. My mother was on bioidentical hormones for probably 8 to 10 years. And she did really well on them. She was happy on them. She stayed on them. As a matter of fact, my mom's divorced, but she, when she's had relationships, she's told me that the hormones have been a lifesaver. They made things possible that she didn't necessarily think were possible in her late 60s, early 70s. But then, unfortunately, my mom, so she's had diabetes for a really long time. And a year and a half ago, she found out she had heart disease. She had chest pain. She actually had the whole Rosie O'Donnell She said, I don't remember all of what it stands for, heat, exhaustion, puke, whatever it is. But basically, she felt those symptoms. So for anybody who doesn't know what I'm talking about, I guess, Rosie O'Donnell had a heart attack, and she now goes around talking about the fact that women's signs and symptoms of a heart attack are different than men's. And so my mom had seen that on TV, luckily. And so she recognized the symptoms and went to the hospital and was told, yes, in fact, they had aborted her heart attack, essentially. She was had just started to have a heart attack, and then of course they gave her nitrates and they did all this stuff. And they actually brought her for stents right away. She had 100% occluded one of her arteries and 50% her widowmaker. And so she got some stents, and she went back to, of course she went for cardiology follow-up and her primary care doctor, and they said, I can't believe you're on hormones. You need to get off these hormones. This was a very difficult and still is very difficult for me, sort of painful thing.
I would have just switched the cardiologist.
I would have too, but unfortunately that's not what my
Right.
mom has chosen to
Right.
do, and it's her health care, and she's happy with the provider she has, and she's decided to continue to stay off hormones, and that is really tough for me because I truly believe that they would decrease her risk of a further heart attack, and that they will decrease her risk of Alzheimer's disease as she gets older, and of course decrease her risk of osteoporosis, and there's a ton of health benefits to her, and so I'm sad that she's not doing that, but unfortunately she's not necessarily embraced this whole integrative medicine model the way that I do. I feel very lucky with the genetics that I have that I've embraced the integrative medicine model, because I'm the only one in my family. I have 2 parents and a brother. They all have weight problems, diabetes or prediabetes, and high blood pressure. I don't have any of those, and obviously I have the genetics for it because it's on both sides. And believe, obviously, it's because I practice what I preach. I live my integrative medicine lifestyle. What brings me the greatest satisfaction is really being able to help patients in a way that other people can't. You know, they come to me sometimes saying that, you know, I'm their last hope, and they can't even imagine feeling better, and then I can help them change their lives and help them go out and do the things that they want to do with their lives. You know, I've had patients who just want to spend more time with their family. They want to see their grandchildren graduate high school. Patients who want to do mission work, you know, and help their church. And, you know, whatever it is that is their goal in life, I want to help them to be able to get to that goal and to be able to, you know, take that trip to the Himalayas and be able to hike the mountain, and, you know, or patients who are doing, you know, marathons or whatever it is that is a patient's goal. To me, the greatest satisfaction is being able to help them reach their goals.
Have you been confronted or had to overcome criticism from your peers in the medical community?
Well, of course, with my own mom. The story, you know, with my own mom, you know, despite the fact that she won't say this, I have a feeling they probably told her that the hormones caused the heart attack. At least that's my guess. You know, of course, there are a lot of doctors who just don't understand what we do. I think the smart ones say, I'm just really not familiar. I don't know. And I think that's the smart ones that admit that they don't know. But unfortunately, one of my mentors and friends had once said to me a great line. She said, with physicians, a lot of times, whatever we're not up on, we're down on. And I thought that was like the greatest way of putting it, because it's true. You know, the way I was taught in medicine, if you didn't know about something, you kind of poo-poo it, you know. That's kind of what most doctors do. So a lot of the doctors who criticize what we do, I truly believe just don't know enough about it. And honestly, I don't think they read enough of the scientific literature, because one of my missions is for women to understand that they need to be on bioidentical hormones. I mean, that is literally, if I had to state in a nutshell, my lifelong dream and mission is for women to understand that they should be on bioidentical hormones, that hormones are actually going to save their life, not increase their risk of disease. You know, the whole craziness that happened in 2002 when the WHI study was ended prematurely because of an increased risk of breast cancer with hormones, you know, that was a very specific combination of hormones, Prem-Pro, Premarin and Provera. Yes, Prem-Pro was shown to increase the risk of breast cancer. But for whatever reason, most of the medical community threw the baby out with the bathwater right at that point, which makes no sense, because for years and years prior to that, we were told that the right thing to do would be to prescribe hormones for women to prevent heart disease, this and that. And so the WHI theoretically was supposed to tell us whether or not it would help reduce the risk of heart disease, whether hormones would. Well, you know, the average age of the women in that study were 65. And now that, 14 years have passed since that study, and they went back and they crunched the data, and they realized, well, the women who were put on it, who were aged 50 to 59, did actually have a decreased risk of heart disease. So that was the outcome of the WHI that they were looking for in the first place. They didn't expect the side effect of breast cancer. And that's because of the Provera. And also, Provera is not good for heart disease either. You know, it's shown in a million different studies that progestins like Provera increase vasospasm. You know, so they cause the vascular system to increase blood pressure, to increase the risk of a heart attack, essentially. So, and even despite using the poor choice of hormones, the estrogen helped those women from 50 to 59 to not build plaque, basically. That's what they showed. But now we have other studies where they've taken into account better hormones that are bioidentical, like the KEEP study. The KEEP study looked at transdermal estrogen, which I think is a better choice because oral estrogens also increase the risk of clotting. So the bottom line is that what you're hearing here is that it's a very complicated topic, and there are a lot of different pieces to it. And if you're not familiar with all those different little nuances and pieces, and I am, because this is what I do all day, every day, Now not only do I practice this medicine, but I teach it all over the world, including medical schools, etc., and to doctors all over the world. And so I review the world literature on this constantly. And so I'm more familiar with it probably than most people out there. And the problem is it's very complicated. There's a lot of ins and outs. And, if I have a half hour or so, I can sit down and explain that to a physician very clearly in a way that opens their eyes and they go, oh, wow, I never realized all of that. Estrogens do decrease the risk of heart disease, osteoporosis, Alzheimer's disease, et cetera, et cetera. The problem was that we had to add something to protect the uterus. Originally, the choice was things like progestins that are not the same as what's in a woman's body naturally, and combining those with estrogen increased the risk of breast cancer. But when you use bioidentical progesterone, it doesn't. It's totally different. So you get all the benefits of estrogen that you're looking for without any of the detriments. And everybody thinks that the WHI study showed that estrogens cause breast cancer. But actually nothing could be further from the truth, because in yet again another nuance, there was an arm of that study that was just women who had hysterectomies, who were on estrogen only. Those women had a decreased risk of breast cancer, and they were followed for 11 years. They had a decreased risk of breast cancer. That study did not show that estrogen causes breast cancer, yet that's what most of the public and doctors walked away with that impression. So it's always just been so unbelievable to me that this is kind of what we're left with, and it's so far from the truth.
Does it change if you have a family history of breast cancer, but you're BRCA negative?
Believe it or well, I'm not 100% sure that they've done that study, family history BRCA negative. But even with BRCA positive, which is even more interesting, really, what the OBGYN societies say now is that even BRCA positive, it's an individualized decision. Because there are very interesting studies that have looked at women who get breast cancer, who've been on hormones, and women who've not been on hormones. So for instance, from that WHI study, the big one, they looked at women who got breast cancer who'd been on hormones and women who'd been on placebo. And you know what? The women on hormones who got breast cancer had a higher likelihood of survival. They were less likely to die of their breast cancer than the women who'd never had hormones. So it seems, strangely enough, that if you get breast cancer, having been on hormones might be protective. And let's face it, the majority, vast majority of women who get breast cancer have never been on any hormones. So everybody has this huge association with hormones and breast cancer, hormones and breast cancer. Well, a big part of that is the choice of hormones, right? But even despite that bad choice of hormones, strangely, if they've been on hormones, they have a decreased risk of dying. So the bottom line is there's still a ton of research that needs to be done in this area. But clearly the studies show that if you use hormones that are exactly the same as what's in a woman's body naturally, the bioidentical hormones, that you're going to have decreased risks.
So personally, what would you hope to accomplish in the next 10 years?
That's one of those big questions. Well, my husband and I are big-time travelers, and specifically motorcycle travelers. We do a lot of adventure motorcycle, like some off-road and some on-road. We've been to, probably 20 different countries in the last 5 years or so. And when the kids are in college, we hope to be able to do even more of that. And I hope to really continue to do more of what I do now is combine that with teaching. So, for instance, I've taught in Dubai several times, and we've extended those trips. I've taught in Brazil before, and I'm going back to Brazil, and we extend those trips. And what I'd like to do is really to be able to teach more about, what I'm talking about today, about integrative medicine, all over the world, because I think, this is really, truly the way that medicine needs to be practiced. I've also recently started working with Dr. Andy Heyman with George Washington University and the integrative medicine department there, and I think that is hugely exciting. that, a major university, which by the way is my alma mater actually. As an undergrad, I went to GW, so it's really exciting to be working with them in their integrative medicine department and bringing together things like metabolic code software, which is really like becoming an artificial intelligence for integrative medicine, which truly is going to be a huge tool that doctors we're going to need in the future, artificial intelligence, because there are more pieces of data than we can possibly hold in one brain. But when we get that data analyzed, we're going to be able to practice really at another level. So using that metabolic code software in conjunction with research, that's really where it's at. Because when we can do research that shows, number one, the patient outcomes that we've been seeing in our practices, when we can do that, we're bringing that together with BodyLogicMD, where we have 15,000 patients. So this was kind of the brainchild of me. Andy and I sat down on the phone about 2 years ago, and we envisioned this whole kind of perfect world for ourselves where we could start doing research, big-time research with, the data that we need with a university, and create a university system for integrative medicine and prove the patient outcomes and also prove the economics of it. Prove that people are actually going to save money. Insurers will save money. People personally will save money when they invest in integrative medicine up front. They're going to save themselves down the line from diabetes care and heart attack care and all of those things. And how could that not be a huge economic savings? But to be able to prove that in the research setting and then be able to finally have integrative medicine adopted as the medicine, that is really my goal, my dream, to be able to do that and
be a part of it.
And to be a part of that and to be able to help bring that to different parts of the world as well.
Who inspires you?
Okay, this is a little-known guy. His name was Semmelweis. I believe his first name is pronounced Ignaz Semmelweis. He was a European physician way back before the germ theory of medicine. So Semmelweis was an OBGYN, and what he told his colleagues was, hey, if we wash our hands between doing deliveries, delivering babies, we'll actually decrease the risk of puerperal fever. So what that means is 30% of moms actually died in childbirth way back when of fever, of infection. But nobody knew why. They didn't even know about germs yet. So he told his colleagues, if we did this, I think that we would have better results. And they laughed him out of town. They laughed him out of town so badly, the poor guy wound up in a mental institution and passed away. And years later, was completely proven right. Years later, he was proven to be absolutely correct, and he just didn't have the ability at that point, because science hadn't gotten to that point, to be able to explain why that would be. But of course, somebody later did the study. They proved that he was totally right. They practically, the risk of dying in childbirth now is extraordinarily low. But really, it was as simple as washing hands. And at least from the writings I've read, doctors were offended that he recommended this, that he would think that their hands were dirty, and how could he possibly recommend? I mean, when you think about it, it's such a small thing. They could have just washed their darn hands, but they instead drove the guy crazy. And so later he was totally proven right. So he's kind of my medical hero.
And who is your personal hero?
Oh. You have to make it really hard.
No,
that isn't hard. That's my grandmother, who passed away right after I got married, actually. So my grandparents were in the Lodz, Poland ghetto during World War II, and my father was born in the ghetto. Wow. And my grandmother arranged to have him smuggled over the wall of the ghetto with the garbage when he was just a week old or something like that, to protect him. And he was raised by a Christian farmer family for about 3 years until they managed to somehow survive the ghetto, and they were liberated. And this makes me a little teary too. I know. I see you getting.
Sorry.
That's okay. And my grandmother was one of the smartest, toughest, bravest people I've ever met. And if it weren't for her, I wouldn't have had my dad, who's another one of my heroes, and I wouldn't be here today. So she's my personal hero.
So answer this question. If you knew then what you know now, what is that?
Medically, I think I would have told myself to be more open-minded, because when you go through medical school and residency and being a physician, you actually become pretty closed-minded. You know, if it wasn't taught to you in medical school, you sort of feel like it doesn't really exist. Or, then in the future, to pay more attention to where I'm getting data from. And even though it looks like data, it might be very cherry-picked, for instance, because in all honesty, let's be truly honest, most doctors get their continuing medical education from the reps that walk into their office or the dinners that they attend. It's, not the extra conferences that they go to necessarily. It could be. But those are usually sponsored by drug reps as well. So a lot of the data that you're getting, as a practicing physician is very cherry-picked. You're not getting the data on what are the alternatives. You're only getting data about this drug or that drug. And, nobody's telling you about, well, if you put this patient on this nutritional supplement, like, for example, berberine, which is a Chinese herb that reduces the risk of diabetes and reduces blood sugar. It's been shown in a head-to-head study to be as good as metformin. But nobody's going to show you that study. So you have to go out and you have to get fascinated with the scientific research. And I am fascinated with scientific research. I love research. I could get lost for like an entire day on PubMed. And just people say they get sucked into the internet and hours go by. For me, that's PubMed. I'm like a PubMed addict. But anyway, so I guess I would have told myself to be more open-minded, to pay more attention to where my scientific research is coming from. One of the things that I would teach myself, my younger self, if I had it to do over again and knew what I know now, is something that I actually teach my patients a lot. And it's about being too much of a people pleaser. Being a healer, we want to fix everybody around us. So, of course, I want to fix everybody. I want to fix my family. I want to fix my friends, and you want to fix them. You want to heal them. And because of that, it causes kind of a Mother Teresa sort of complex. And so, you wind up doing everything for everybody else, in some cases that they could and should be doing for themselves, and you wind up putting yourself last. And I think I would have taught myself to make myself more of a priority, because when you do that, when you live in a way where you're doing everything for everybody else around you and not enough for yourself, you have low self-care. And when self-care is low, a very brilliant marital and family therapist taught me, when self-care is low, resentment is high. When you start feeling like everybody else around you isn't doing what they should be doing, isn't doing their share, whatever, you have to look at your own self-care and putting yourself as more of a priority and maybe not doing as many things for other people. And that was something I did for a really long time. But then I learned that I had to put some boundaries in place and teach other people that they need to do some of those things for themselves. And
so when are you writing that book?
Yeah. No kidding. I mean, I think that is a huge lesson that so many people need to learn. And when they do, well, at least for me, when I did, it was when I figured out that I wasn't responsible for other people's feelings, for other people's, especially their feelings, because I went to such great lengths to protect other people's feelings and to make them feel okay and So I was always juggling a million balls and walking on eggshells. And when I figured out that I didn't have to do that anymore, it was like somebody took a pin and popped a balloon and just went on my stress. And so, yeah, I'm a busy doctor, mom, wife. I lecture all over the world. I'm flying around a lot. I do a lot, but I'm not stressed out really because I learned that I don't have to be responsible for everybody's feelings. And I think that was the biggest de-stressor for me ever. And I think stress is a huge part of what causes disease. And if I had yet another message, well, for myself from when I was young to now, and then for the rest of the world, that's one of them.
What was the last book you read for enjoyment?
I'm reading a book right now. Because I'm busy, like you said, I listen to books on tape a lot when I'm in the car. So the book I'm reading right now is called The Subtle Art of Not Giving a Bleep. It starts with an F and ends with a K. By a guy named Mark Manson. And I really do not know what Mark Manson's qualifications are in writing this book, other than maybe just being a really cool guy. If you're offended by foul language, don't read it. He uses a lot of it, but I actually like it. I'm a pretty frank person, so I like frank speech. One of the things I was reading last night and I was passing on to my son was the concept of radical responsibility. The fact that we need to be responsible for everything that happens in our lives. Not necessarily to blame for everything. He gave a great example of a man who had lost his son. And and the man wrote him on a blog post, how could you say I'm at fault for losing my son? And and of course it's a tragic and horrible thing. And he's told the guy, the guy making the comment told the author, you know nothing about pain and emotional pain. How can you talk like that? And the author, I think, very astutely pointed out, obviously that man had nothing to do with losing his son and wouldn't have wished that in a million years, but he does have an option as to how he handles it. And that's where his responsibility comes in. And so that's just an example of radical responsibility. And, so my son was telling me about some things he was upset about and blaming a lot of it on the outside world in a lot of different ways, other people and institutions and this and that and the other thing. And I said, no, I'm sorry, but you really have to take responsibility for that. And as a matter of fact, I'd love you to take radical responsibility, which is really just looking at how you can change yourself. And it was really interesting. He talked about, what are your values? And, unfortunately, a lot of us, our values are pretty screwed up these days. Our values might be about being more popular or making the most money or having the biggest house or the biggest car or whatever. But, all of those things are things in the outside world. And what he talked about was, trying to go back to values that you can control, honesty, loyalty, creativity. What are the things that you value, because those things are really going to steer your life. And I like to read books that make me think about life. I think a lot of us are way too busy living life and not busy enough thinking about life and actually engineering our lives, how we want our lives to be. And so I spend some time thinking about that and reading books about that.
So it took one therapist to tell you about this to change your life.
Seriously, yes.
So I'm asking you, so I know that how you've implemented both, you practice what you preach, but how you've implemented your integrative medicine into your practice, and you were introduced to BodyLogic. If a physician came to you and asked you, if they would, that they were starting the fellowship, for example, and they came to you and they said, Dr. Landa, Jen, how do I do this? Where do I begin? How do I implement this into my practice? How do I change my life? What would you tell them?
Well, my simple, easy answer would be join BodyLogicMD. But obviously not everybody's going to join BodyLogicMD. So, I think it's somewhat individualized, to be realistic. It's different people are in different sorts of practices. some practices, like being an OBGYN, you can integrate it kind of day by day. You know, you can start doing some bioidentical hormones, you can start using some nutritional supplements. Doing primary care, OBGYN, you can do those kind of things. But, you know, as an emergency room physician where, you know, an anesthesiologist, I mean, you know, they don't have that option, you know. But, you know, they do have the option of possibly starting one day a week where they start, you know, a small practice where they can start to see people and, you know, start to integrate this way of practicing medicine. You know, I think that's the way to start, you know, like truly to start small and to start, well, and truly, really, wait, let me back up. Start with yourself. That's the very first thing you need to start with. And most people will find that there are a ton of things that they need to change. And then start with your family members if they're interested and willing. My husband is actually one of my most compliant patients ever. And, you know, and then start, you know, with some of the people around you and start seeing the results and start seeing what, you know, what the changes are that you can make for people, and then really start dreaming about going a lot bigger with it, you know, and opening an integrative medicine practice and doing what I do, because honestly, it's not only a way to take better care of patients, but it's a better way to take care of yourself. It will absolutely change your life, because the way that you're practicing, talking to you as if you practice medicine, but anyway.
My spare time.
Yeah. So the way that people practice medicine now, I mean, there's so little satisfaction in it. It's terrible, actually. What's happened to medicine and doctors, I feel blessed every day that I got out of the sort of mainstream of medicine and I have this different way of doing things. But, you know, if you feel beaten down by the system, you know, if people feel that way, you know, they have to realize that they're sort of allowing that to happen because there is another way, you know. But I know that it stinks to be told by insurance companies how to practice medicine. To be able to make enough money in medicine, you have to see patients, you know, every 7 to 10 minutes. You have to turn them through, so you have no time to sit and counsel them about their nutrition or supplements or this or that. All you have time to do is write a script. And people just get burnt out on that. There's no satisfaction in that. There's no, you know, and you're seeing, you know, I don't know, 25, 50, no, more like 50 patients a day, a lot of doctors I've heard of. And there's no way you're not exhausted by the end of the day. So, you know, practicing integrative medicine, I see about, on my busiest, craziest day, I might see 14 patients. On average, maybe, you know, 8, 10, something like that. It's just a better way of being able to get to know your patients better, have more of a human interaction and connection, have more time for yourself where you're able to engage in the intellectual pursuit of practicing medicine. You really get to, you know, be a diagnostician and think hard about what you'll do for these different patients and how the different pieces of the body fit together. Because, you know, in traditional medicine, it's like silo medicine. You know, there's the lungs and there's the heart and there's the GI system, and none of them have, and the brain, and none of them have anything to do with each other. And integrative medicine, nothing could be further from the truth. How interconnected they are is actually fascinating, and how well you can help a patient when you really see all those connections and you start to treat the whole person. You have so much more career satisfaction, so much less stress. And, you know, that's a way to overcome a lot of the HPA axis stress that you have. So, you know, somebody starting out in the fellowship now, I would tell them, start with yourselves, start with your family, and then start integrating this into your practice slowly but surely, little bit by little bit, and ultimately take the leap into practicing full-time integrative medicine. You've got to get rid of insurance pretty much, which is a scary leap for a lot of people, but it truly does make the difference. And I truly believe if all doctors stopped taking the insurance and started practicing this way, it would really change a lot about medicine too, because a lot of patients want what we're offering. They really do, and they're willing to pay for it outside of their insurance payments. One of my patients said to me recently, I think this is fascinating, she thinks about her health insurance like she thinks about her car insurance. Health insurance is there in case you break a leg or you, God forbid, get in a major traumatic accident and, you have hundreds of thousands of dollars worth of hospital bills. But health insurance nowadays doesn't seem to really take care of the day-to-day very much. The prevention and the maintenance that you need, just like your car insurance, doesn't take care of prevention and maintenance, your oil changes, your transmission fluid, whatever. I don't know much about cars, but car maintenance obviously is an added expense not taken care of in your insurance. One of my patients said, that's the way I think of my health insurance now, and I thought it was an amazing analogy, and I said, wow. As sad as it is, because health insurance is way too expensive to be just that, but that's pretty much what it is, catastrophic.
Thank you so much.
Thank you.